so we're going to go ahead and go through the intubation process. There's typically quite a bit of things that I might ask my EMT to do as I'm getting ready to go ahead and intubate. Now, if this patient needs intubation, either we're about to sedate this patient to intubate them, or sometimes these patients are already unconscious, they can't control their own airway, so this patient maybe will be somebody who already maybe have a basic airway in place, like an OPA or an NPA, and we're ventilating for this patient. So as we come around, a couple of the different things that I might ask my EMT to do is, number one is I might ask him or her to grab the tube tamer, right, or the device to go ahead and secure my airway. Now, always get things set up before you go ahead and do anything else. So to get this set up, pull it out of the package, slide it right behind my patient's neck, and that's all ready to go. The next thing we need to do is we also need to get the McGill forceps ready, just in case we go to look down this patient's airway and maybe this patient's got some sort of, obstruction down there that we need to pull out. Another thing to have ready is actually suction. Right? I don't have my suction device set up, but when we go to intubate, these are all things that we need in place, ready to go prior to intubation. Now, the next thing is capnography. Like I mentioned before, this is probably the most important aspect of this whole process. Now, you guys saw that I already have a basic airway in place, and I am going ahead and I'm going to be breathing for my patient. Now, this capnography device reads exhaled CO2, but it can actually be put on my BVM. So, right, this little plastic tube here is going to go directly between my BVM and my mask, right, and it's going to hook up directly into onto my patient's BVM. This other side, right, where this orange tube goes, right, it actually connects to the cardiac monitor, and it attaches to my cardiac monitor, just screws in, and you can read your patient's exhaled CO2. All right, so we also have our colorimetric capnography. Maybe you're utilizing something like this. Same thing, the colorimetric device goes directly in between my BVM and my patient's mask. So we're still going to be controlling this airway even with capnography already in place, ready to go. So once I have capnography, the last thing I need is my ET tube. ET tube should come in a package. A couple different things that we might need with it is, number one is a syringe, a 10 cc syringe. I've got one already hooked up there. I'm ready to go. If you can see here with my balloon, right, this 10 cc syringe actually fills up the balloon with air, right, and I make sure that that's what keeps and isolates my patient's airway. It also helps kind of keep that ET tube in place. So I always try to pump up my balloon before I go ahead and intubate my patient, just to make sure that it doesn't have any leaks in it and it's ready to go. But with our ET tubes, one important thing, you guys, is we want to keep this sterile. This is about to be inserted in the patient's airway, so we don't want to put this on the patient, maybe on the floor or anything else. We should leave it in the package as much as possible until we're ready to insert that into our patient's airway. Last thing with our ET tube is it does come with this internal device to go ahead and keep it nice and rigid. This is known as a stylet. And we want to make sure that stylet is in place. We also want to make sure it is not poking out the end of our tube as we go ahead and insert it, because that can perforate a patient's trachea. Now that I've got all of my devices set and in place, all right, I'm going to go ahead and intubate my patient. Now remember, you guys, at this point, hopefully my EMT, either they've gotten this equipment set up for me, or as a paramedic, I've been setting it up while my EMT's been controlling the airway. And now typically what I have my EMT to do is right before I go ahead and intubate, I have them stop breathing for the patient and remove the OPA, right? And now I go in as the paramedic to intubate this patient. All right, and go ahead and stand by with the BVM ready to go. As a paramedic, I'm gonna take the ET tube. I'm gonna insert my laryngoscope into my patient's mouth, just looking all the way down, nice and easy, nice and slow, until I see my patient's epiglottis and their vocal cords. I'm gonna take my right hand, I'm just gonna go ahead and slowly insert that ET tube into my patient's trachea. All right, and I'm gonna go ahead and inflate my balloon, remove my syringe, and remove the stylet. Now that that is in place, my EMT can bring over the BVM, and we can attach that BVM directly to my patient's ET tube. All right, and we can breathe for our patient. Again, this goes ahead. This inserts air directly into my patient's lungs, and it's just a direct shot. And it's a good way to isolate that patient's airway and control that patient's airway, and a patient who they can't do that themselves. We're going to continue breathing for this patient, one breath every 5 to 6 seconds, and that is how we insert an advanced airway.